Hi, this is Eitan Shalom, and I am here today with my patient who has low back pain, really, especially in the sacral area, down into the buttock and the side of the leg. And she did have a bulging disc about 2 years ago, which seems to have a lingering effect. And so I'm doing dry needling style acupuncture in the trigger points of the paravertebral muscles and the motor points of the Quadratus lumborum. Here we have the motor points of the Quadratus lumborum. Here we have trigger points in the paravertebrals, and here we have in the spinous process space between the vertebra of L4-5 and L5-S1 into the ligament there, and that helps to release the vertebral spaces. And I've done the same points on the other side, so it's very much a bilateral treatment. And then because of the hip pain on this side, I have done the Gluteus, medius, and minimus motor points. I have a point into the sacroiliac joint. This is an acupuncture point that releases the fascia up into the low back. And so, we do have the history with acupuncture of orthopedic acupuncture, where we have points that are to release the fascia. And then down here into the piriformis motor point. And let's see. Actually, that's the piriformis motor. No, this is piriformis motor point. And then down here we have the quadratus femoris motor point. And then on the side here we have some points on the IT band to release the fascia of the IT band. Now these are fascia points. They're not motor points or exactly trigger points. And in fact, this one is an acupuncture point that I very often use when I have somebody with any kind of low back pain, because it's on the gallbladder channel, and the gallbladder channel runs through the buttock, and it's a great point for releasing the low back, the fascia of the low back. And what's interesting is how you find this point. This one here is you take the person's hand, their arm, and you flatten. See, right now her arm is relaxed, but what you do is you have her push her arm against the body, so it's flat with the palm this way. Don't do it though, you've got the needles. And then when you straighten it out, it'll invariably end up right about there. And you can feel with your finger, there's like a little depression in there where that point is. So even if you didn't have let's say the person didn't have an arm, you can still find that point. In fact, the first really positive acupuncture treatment I had was in Chicago with a guy who went on to be a well-known translator from the Chinese. In fact, when I met him, he was on his way to China to study Chinese, on his way to Taiwan. This is when we didn't have diplomatic relations yet. Yeah, well, we did, but not much with mainland China. To make a long story short, I asked him, how do you find the points? And he said, in a very sort of mystical way, he said, well, I can find every point with my finger. He didn't explain. He made it sound like he was really cool. And he was, but the fact is, when you study acupuncture, you learn how to find every single point with your finger, because every acupuncture point has some kind of anatomical prominence, whether it's this point here, which is just to the inside of that bone, or this point where you come up here and your finger, sinks into it. So all of the points are little depressions or caves, and so you can actually feel them. But when you're doing dry needling, like when I'm looking for the motor point of the Quadratus lumborum, I know where the motor point is, and then I'm going to do it on her arm. I palpate, and then you'll feel, how do you find the motor point? You'll feel a kind of bump in the muscle, a kind of thickened area, and that's invariably going to be your motor point, and the same is true with trigger points. So before I put any of these needles in, I'm always palpating, I'm feeling. So if I were going to treat her for carpal tunnel, for example, I would feel in the carpal tunnel here until I sink into this depression right here. That would be one point that I would use. If I was treating tendinitis of this tendon here, I would be palpating that tendon until I found the spot where I want to put the needle in. And that's how you find trigger points, motor points, and acupuncture points. Thank you for tuning in.